Welcome to Encounter, where we celebrate putting faith into action and community leaders who live out compassion, grace, and love. We're a program of the Broome County Council of Churches that addresses food insecurity through chow and the Greater Good Grocery, provides hospital and jail ministry, builds wheelchair ramps, and assists neighbors with transportation and shopping services through Faith in Action volunteers. We invite you to the conversation. Encounter your neighbors as we learn to walk together in love and kindness.
Brothers and sisters, welcome to the Encounter program sponsored by the Broome County Council of Churches. I'm your host, Mark Kimpland, the pastor at the Endwell United Methodist Church. For about 10 years, I have enjoyed hosting these programs because I learned so much, and I have been able to meet such wonderful people doing such wonderful work in this area. But I have a confession on this particular show today. There is a sense of self-interest in this show as I turn 65 at the end of this year. And so it is my honor, and I am thrilled to have with us today Leann Keim, who is the coordinator for the Health Insurance Information Counseling and Assistance Program. I got that all right?
You got that
HIICAP,
right.
All right,
Yep.
Or HIICAP, I should say. And I am so glad that we were able to make this happen because I'm receiving lots of information in the mail these days. I'm much more popular than I have been earlier and such. And I thought it was important that we kind of share what it is your agency does and how you do it, because there's one theme about Medicare that I hear is that it's so complicated, and people just have not yet to get their head around that. And so I'm hoping this time will be a blessing to me and you and your agency and everyone that's joining. So welcome to Encounter.
Thank you so much, Pastor Mark.
Yeah, absolutely.
So the agency that you're talking about is Action for Older Persons, which is where the HIICAP program is located. The HIICAP program is a federally funded program. At the federal level, it is called SHIP, State Health Insurance Program. It was created because it was determined that Medicare was so complicated that they wanted people to have the opportunity to go to a no-cost, unbiased information Medicare counseling session, and that is how it became HIICAP in New York State. So if you hear the term SHIP or HIICAP, they are interchangeable.
Okay.
And every state in the country has SHIP counselors.
Awesome.
So that federal fund for us at Action for Older Persons, it comes from the Broome County Office for Aging. We also get funding for this program from the United Way. They're one of our largest funders. Town of Union, City of Binghamton, and the Klee Foundation. We also get some funding for the program through memberships for Action for Older Persons.
Okay. How did, in the travels of your life, how did you get connected with this? Can you connect some dots for me on that one?
Sure. Yeah. So I grew up in Western New York, and I came to this area through IBM, which several of us, I'm sure, did. And I've been in this area now for about 40 years. I've had several different careers, and I was lucky enough to be a stay-at-home mom for several of those years as well. About a year, well, it's been since July of 2023, I have found myself in this position of being the HIICAP coordinator for Broome County. So everything we talk about here today is for Broome County.
Okay.
And there is a SHIP or HIICAP coordinator in all of the other counties in New York State, and as I mentioned, also in other states across the country.
Okay.
So I have not quite been in the position for a year. Yeah. I myself had no idea how complicated Medicare was until I came here, and I still feel like I have quite a bit to learn. Sure,
yes, yeah. But that is a common theme with people, just kind of overwhelmed and perplexed about, and I know I am, that it's looming probably, 7 months ahead of me, and I've done my best to try to get a handle on it, but it is difficult, no doubt about it. I'm glad you have many acronyms also. In the United Methodist Church and within churches, we have all kinds of acronyms that we think other people know, and we kind of have to explain that to people.
Yes, and that is another thing that you have to learn when you come into the Medicare system. There are a lot of acronyms.
Yes.
There's no question.
Yes, no
Yeah.
doubt. Well, I guess we've touched on this a little bit, but the elephant in the room, why do we need this program? What will it do for us if we get connected somehow in some way?
So the program is needed for many reasons, and the one that's the highlight for me is that it is a no-cost, unbiased Medicare counseling. We are the only organization in Broome County that will provide you with all of the options available to you for your Medicare health care. And right now, there's about 65 million people, Americans, that are on Medicare.
Wow.
And you get onto Medicare in one of three ways. You either age into it, as you will be
Yes.
doing in December.
Yep.
You have been receiving Social Security disability for 24 months. After that time, you automatically then go on to Medicare. Or if you have end-stage renal disease or ALS. Medicare is a base protection program, so there always was supposed to be a cost sharing between your provider and you, and that's how Medicare is set up. So the reason why we need the HIICAP program is to tell people about what all the different things are that they're going to have to understand in order to pick the right plan for them. With Medicare, there are 4 parts to it. There's Part A, which is your hospital coverage, and you may see the Medicare card that's sitting on the table here from time to time.
Yep.
So the Part A shows up on your Medicare card, which is the red, white, and blue card. The Part B is your medical insurance. And let me backtrack. Part A is typically free for most everybody. Okay. Part B is your medical insurance. That covers a lot of your outpatient services that you get. There is a monthly premium for that. It's $174.70 this year. Some people might pay less, some people might pay more, but for most it's $174.70. Part C of Medicare is Medicare Advantage plans. There is a Part D, which is the prescription drug. Those are standalone prescription drug plans.
Okay.
And then the last part of Medicare is Medicare supplemental plans. You might also have heard of a Medigap plan. Those two things are the same thing.
Okay.
So when you're going on to Medicare, there's 2 primary choices. You might pick that Part C, which is a Medicare Advantage plan. That is when your health care is administered by a private insurance company. They typically bundle your Part A, hospital care, Part B, medical care, and Part D, your drug plan. They bundle that all into one plan. Okay. And that company then administers all your Medicare options for you. The other choice that people typically make is they keep their Medicare red, white, and blue card, their Part A and B there. They buy a standalone prescription Part D drug plan, and then they buy that Medicare supplement or the Medigap plan. And that is how they get their Medicare coverage. In Broome County, for 2024, there are 52 Medicare Advantage plans. 42 of them have drug coverage. There are 12 different Medicare supplement plans sold by 9 different private insurance companies, and then there are 15 Part D prescription drug plans.
Yeah.
So when you look at that alone, that is partly why when you're first coming into this, it's so very confusing because you might think that's a lot of options.
Yes.
Right?
Yes.
So one of the things that we are able to do with people when they come in to see us for the HIICAP program is to help them figure out the best plans for them based on their individualized needs. And we also want to make sure that they know all the rules so they can avoid any future penalties.
Yes, I've heard a little bit about those penalties and such, and they scare me.
Yes.
And you really have to be have some knowledge about what you're getting into, and you do it at the right time and the right way.
You got that right.
Yeah.
Yes, and we certainly can help people with all of that information.
Okay, all right. Friends, our guest today is Leann Keim. She is the coordinator for the Health Insurance Information Counseling and Assistance Program, HIICAP, of Broome County. Just one question, and we may get to this, I wasn't sure if I saw this or not, whether you bundle it or you do a different Part C through another supplier or such things. I think I remember that there was some geographical differences between the two. That is one better than the other, depending at, like, if you travel a lot, and one's perhaps more restrictive than the other. Is that true?
Yeah, so that is where, so, you know, the way we look at it is what's best for the person's individual needs.
Yeah.
So you are correct. If you stay with your red, white, and blue card with a supplement and a Part D prescription program, if you do that, original Medicare, and that's kind of what I'm going to call that part of Medicare,
right,
original
yeah,
Medicare,
yes.
is accepted for in any facility or doctor. If you go to any facility or doctor that accepts Medicare, they will accept that insurance. Original Medicare does not give you dental, vision, or hearing coverage. So if you go into a Part C or Medicare Advantage plan, you do get those extra benefits. However, it could be a little bit more restrictive in terms of where that plan might be accepted, but there are certain Medicare Advantage plans that have in and out of network benefits. So we really work with that person to understand what their needs are, what their goals are, where they might be traveling, to help them determine what might be the best situation for themselves.
Yeah, I've learned quickly here, it's not one size fits all all. Yeah.
It's not at all,
Yes,
and it's very likely that your two spouses could have two different Medicare plans, because these are individualized.
Yeah, that's a good point. Yeah, never thought of that.
Yeah, that can happen.
Yeah, okay, indeed. Are there other special things about the program that you want to highlight to our listeners and viewers and such things that are unique maybe to HIICAP?
Yeah, so as I mentioned, I started in this position July of 2023. So I haven't been there a full year yet, but I was really impressed to find that in 2023, for the whole year, our HIICAP program in Broome County, we served about 2,400 clients, and we saved them over $3.38 million, which I thought was incredibly impressive.
Yes, absolutely.
For what this small team is doing for the residents of Broome County.
Yeah.
We are one of the largest HIICAP programs in New York State. So the HIICAP programs really are meant to be a volunteer program. So some counties might have one or two staff members that are doing the HIICAP program. Here in our county, we have 17 volunteers that do the counseling, and we also have 2 administrative volunteers. We're really well respected locally and at the New York State Office for Aging with the program that we have put together. We host the annual regional training where Medicare Rights Center and state educators come down to make sure that everybody in the surrounding counties that do this work, they have all the information they're going to need going into the next year. We participate in the focus groups for the state certification exams, and we also organize the Southern Tier HIICAP Coordinators group, which is just basically a consortium of the HIICAP coordinators in the surrounding counties, so we all can support each other in this work. And then I would also say that statewide, we won an award in September of 2019.
That's awesome. Yeah.
And we do a lot of outreach. So we do seminars in our office. We go to churches, we go to senior centers, we write articles. We really try to get the information out about this program. And we also get lots of referrals. We try to go to the pharmacies and put the rack cards up. We talk to the pharmacists. Pharmacists will refer people, doctors, other agencies refer to us, and you can self-refer. If you have any questions about Medicare and you're a Broome County resident, you certainly can call us.
That's awesome. I mean, I know I was connected through this, the agency just through a friend, and who told me about it and had used it and spoke very highly of it.
Well, I do think we get a lot of, we do ask people when they come in, how did you hear about us?
Yes.
And we have a lot of friends and family that are referring people, and we do get a lot of very overwhelmingly positive reviews of the service that we provide.
Yeah, Yeah, no, this is exciting. How can you describe? I know you probably can't, but the best of your ability, talk about the clients. I mean, I know there isn't a certain cookie cutter client that comes in, but can you talk about who uses this, the service, and a little bit about the clients that you serve?
Yes, so you're right, there is no cookie cutter, and we see people from all walks of life. People will call us if they're new to Medicare, so I will be expecting you will be giving us a call sometime in maybe October.
Absolutely.
Because you really would want to
Yes.
start thinking about 3 months before you're
Yes.
about to turn 65.
Yes.
And so we have a lot of people like you that come in to see us. We have people who range from high income, maybe doctors and professionals, lawyers, to people that are on Medicaid. We have people that come in that are age 20 to over 100. We have parents that are coming in with their disabled children who might be on Medicare and have questions.
Yes.
We have adults who are representing their elderly parents. We also work with some case managers that are in the community that are representing vulnerable populations.
Yeah. One of the interesting things that I hear you saying, it's not just to get you started on Medicare, though it can be, but it can be long before and as you're in the program. I just shared with you, I heard from my mother-in-law. She's 87 years old, and she now has more questions, which is really great to have that resource available no matter where you might be, along that process.
Yeah, and I will give you a little bit more information about, specifically for someone like you who will be turning 65 in December. So if you are already collecting Social Security, you will automatically get your Medicare card in the mail 3 months before your birthday. That will happen automatically if you're collecting Social Security. If you are not collecting Social Security, you need to do something. You need to make sure, if you're going to continue working, you need to call us to make sure that you're following the rules. If you are not collecting Social Security, you need to get in touch with the Social Security office if you're going to start Medicare on the month of your birthday. So there are just a lot of things you need to know, which is why it's really important. If you're new to Medicare and you really don't know the rules, give us a call.
Yeah, as I understand, timing is of the essence.
Timing is of the essence, yes.
And if you get that wrong, there are some...
those penalties will come into play.
Yes.
Yeah, and we don't want anybody to have a penalty.
Yes, all right, good, I like that. Friends, we are blessed today to have on the Encounter program Leann Keim, who is the coordinator for the Health Insurance Information Counseling and Assistance Program, which is called HIICAP. Are there other reasons why people would use AOP for any other reasons and such things that you want to talk about, or about what we've been talking about regarding HIICAP? Yeah.
So, I mean, we've already talked about that people come in because they're new to Medicare, or maybe they have some questions about the plan that they're in. Sometimes something might change during the middle of the year, so I would like to make sure people know that if something changes in the middle of the year, maybe you go on a different medication or you have a different healthcare diagnosis that you're concerned about, I would encourage people to call us, because I know most people on Medicare understand that there's an open enrollment every year. And everybody typically knows that that is the one time a year you can change your plan. But there are other opportunities during the year with which you can change your Medicare plan potentially. We can almost always help somebody. So if you have something that happens in the middle of the year that you're concerned about, I would encourage you to call us and see if there's something we might be able to do to help you. The other thing that we do during our Medicare counseling sessions is we do screen for savings programs. So there's one that's called EPIC. It is the Elderly Pharmaceutical Insurance Coverage Program. That is the New York State Part D coverage. There is the Medicare Savings Program. That is something that is an ongoing application. We'll determine if you're eligible, and we can help you fill that out in the office. Then there's some other things we can look at too as ways to save you money. So that is, I would really encourage people to look at that as well and give us a call if they think they would like more information about that particular program.
Yeah, yeah. Are there certain guardrails that are in place? The enrollment period, I get that. All you have to do is look on the television and kind of know when that is.
Yeah.
Every celebrity under the sun, makes their pitch. But are there determinations as to the things that you can change throughout the year and can't change throughout the year? Are there? I would imagine it's a little trickier.
It can be a little bit trickier, but we have ways in which we can help you.
Okay.
So I would say don't make any assumptions that you can't change.
Okay, thank you for
I would say
sharing that.
call us.
Okay.
And we will see if there's something we can do to help you, because it can be advantageous for people to make a change during the year.
Yeah.
So, and one of the things people might be wondering about is what to expect if they come in for a counseling appointment.
Yes.
We require that you make an appointment. We do not take walk-ins. So there are two ways in which you can get an appointment with us for a HIICAP counseling session. One is an in-person appointment at our office. We have moved to Endicott. We are now at 609 East Main Street. We're near the Arch and the McDonald's. We're in the Medicare Summit Arts Building. So you can come there for an in-person appointment as long as you have called and made that appointment prior to coming in. And the other way you can get an appointment with a HIICAP counselor is over the phone. It was something that we did during COVID, and it actually has turned out to be a really nice option to offer people, especially in our rural areas in Broome County, because we're so large.
Yes.
So we can give you a phone appointment as well.
Yes.
They last about an hour. It will be a one-on-one appointment with one of our highly trained Medicare counselors. These counselors have to go through a lot of training.
I read that. I'm oh my gosh, that's great.
Yeah, this is not just a sort of nonchalant volunteer opportunity. You really need to be dedicated, and you go through a lot of training. You have online courses, you have in-person courses, you have to shadow experienced counselors, and then you also have to pass a state certification test every year.
Yeah, things change.
They really do, and so I really have a lot of faith in all of our wonderful volunteers, and I'm very lucky that we have 17 of them. We do provide them with a binder full of materials that they use for the counseling sessions. We do monthly in-services where we educate them about anything that's changing or coming up that's new, and we also have an annual regional training that we host here, where the state and the Medicare Rights Center comes in to make sure that they're aware of all the changes coming for the next year.
Yeah. Oh, what a gift! What a gift! So, what are the challenges? I'm sure there are some, but what are some of the challenges?
One of the big challenges is the Medicare system changes every year, so we really have to stay on top of everything. Which, getting that information out to the volunteers in a timely manner so that they can then counsel people effectively is a challenge. But I would say probably our biggest challenge is the volunteers. We have a very high demand for our service. We do not have enough volunteers, especially during open enrollment, to meet the need. So unfortunately, toward the end of the open enrollment period, we do have to send some of the local Broome County residents to the state for the help that they need, because we just don't have enough appointment slots. So we're always looking for volunteers. I would say some of the qualities you need to be a volunteer would be that you need to have pretty good computer skills, because we do use the Medicare.gov system to figure out what the best Medicare options are for people. You need to be a people person, because we deal with all kinds of people, and we want to make sure that you're able to talk to anybody that comes in the door. Also, you need to have the time to devote to the training. I'm excited to say that I'm about to start a new volunteer training session. I have
Okay.
4 people.
Wonderful.
So that is wonderful, but we can always use more.
Yeah.
So if you think that you might be interested in doing something like this, I would really encourage you again to call, and I could give you some more information about the specifics of being a volunteer in our HIICAP program.
Awesome. Now, you mentioned something about membership, an AOP membership. Can you just touch on that for a moment as to what that is?
Yes. So at Action for Older Persons, one of the way we get our fundings is through memberships. And one of the perks of the memberships is that during open enrollment, you get to call early to set up your open enrollment appointment. So you will be assured of getting an appointment with one of our counselors.
Okay.
And there are some other perks as well. You could call our front desk and they would be happy to tell you all about what the other membership perks are and what the cost is.
Okay. Oh, that's great. One thing I do like to, I want to, we have about 2.5 minutes left. Is there anything else that you would like to share with our listeners and viewers that maybe we didn't get to about this very, very important work that you're doing?
One thing I would like to share is that very recently we got a contract for Otsego, Delaware, Cortland, and Shenango counties to do Medicare savings programs in those areas. So we have that contract. So if we have viewers today that are watching that live in those counties that want more information about the Medicare savings program, they can call our office. But for the Medicare counseling, they will call the HIICAP person in their own county. We can certainly give them that information if they need it, but we can help people in those counties with their Medicare Savings Program applications.
Now, what exactly is that? Can you describe that? Is that something that's relatively new? Has it been around a while, or can you?
It has been around a
snapshot?
while, and what
Okay.
I would like to tell people about that program, it is income-based only. They do not look at your assets.
Okay.
So if you are a single person, the income limit this year for a single person is $2,355, and that is your gross monthly income. And for a married couple, it is $3,189 for a gross monthly income. So if you are under that, or if you're very close to that, I would say within $50 of that, you should give us a call, because there are ways we might be able to help you qualify for that. It pays your Part B premium and gives you a free drug plan and low co-pays on your medications. So it's really helpful for people.
Worth the time. Yes.
Worth the time,
yes,
for sure.
No doubt about it. Leann, I just want to thank you. This has been enlightening. I've learned a great deal, as I know that our viewers and listeners have also learned. I keep up the good work, please. This is one of the great joys I have in my ministry, is to be a part of the show, just to uncover the gems that are in our area that maybe we don't know about or know as much about as we should. So I want to thank you for being on this program and enlightening and inspiring and informing us. So thank you.
Thank you so much.
I appreciate it. Brothers and sisters, I know that this has been a blessing to you, and I just ask that we go out into the world and be kind and gentle with each other, and thank you for tuning in to this program of the Encounter program. Have a blessed day.